Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Cushing syndrome, questions and answers. What is Cushing syndrome? This is a clinical syndrome due to excessive cortisol, that is also called hypercortisolism, due to neoplasm of the anterior lobe of the pituitary gland, adrenocortical tumor, ectopic ACTH production, or long-term glucocorticoid therapy. So this is a condition when there will be excessive cortisol will be secreted. What is Cushing disease? Cushing disease is a type of Cushing syndrome caused by pituitary adrenocorticosteroid hormone excess, that is ACTH, that is coming out of the anterior pituitary. If that is excess, we call it Cushing disease. This is a variety of Cushing syndrome. What are the features of Cushing syndrome? Hypercortisolism. The most common cause is exogenous administration of steroid, and the most common cause of endogenous type of Cushing syndrome is caused by the pituitary tumor secreting adrenocorticotropic hormone. Cushing disease is more common among female. Okay, what are the common signs and symptoms of Cushing syndrome? We have moon face, central obesity, virilization. Virilization is a condition when there will be unsightly places with hair will grow in unsightly places, male type body. Initially we call it hirsutism, then the body figure will be like that of a male in a female. We call it virilization. That happens due to excessive androgen secretion, maybe testosterone. Menstrual irregularities, hypogonadism, hypertension, hyperglycemia, thin extremities. Extremities are thin. Okay. Muscle wasting, muscle will be wasted. Muscle wasting, myopathy, osteoporosis, skin fragility, supraclavicular fat here, and buffalo hump. Ecchymosis, there may be bleeding under the skin. Red purple abdominal stera, these are the red purple abdominal stera. Poor wound healing, hair will be lost. Hyperpigmentation, when there is ACTH excess, is a cause of Cushing syndrome. Mental instability, there may be psychosis or euphoria, sense of pleasure or satisfaction. Okay, that may happen. So if we learn some physiology, we'll find out that there is axis, hypothalamus, pituitary, adrenal cortex axis. So due to stress, there will be release of the corticotropic releasing factor from the hypothalamus, and that will go to the anterior pituitary to stimulate the anterior pituitary. Anterior pituitary will release the adrenocorticotropic hormone that work on the adrenal cortex. Okay, and it will stimulate the zona fasciculata that will increase the secretion of cortisol, maybe a little bit androgen. So that is in the zona fasciculata layer. Here, this is the kidney, this is the adrenal cortex, this is the adrenal medulla, this is adrenal medulla, adrenal cortex here. Okay, it should be on the kidney, and what will happen? Cortisol will cause gluconeogenesis, production of glucose other than the carbohydrate source. Okay, there is gluconeogenesis, proteolysis that may lead to myopathy, muscle wasting, fat mobilization, lipolysis, and this cortisol also stabilizes lysozyme, so that will work against inflammation. Okay, so this is the physiology of cortical secretion, cortisol secretion. Cortisol source is from the zona fasciculata. It is stimulated by the ACTase from anterior pituitary. Anterior pituitary is stimulated by the hypothalamic corticotropic factor from the hypothalamus of the brain. And in stressful situation, hypothalamus is excited to produce that. There's some feedback mechanism. We have, if there is excessive cortisol, so ACTase will not be released from the anterior pituitary. If we have excessive cortisol, hypothalamus will not produce the corticotropic releasing factor. Okay, so here is that what is the etiology of Cushing syndrome? Long-term intake of steroid, exogenous or iatrogenic. This is the most important cause. If a person take the steroid for a long time, then the adrenal cortex will be thinned out a little bit. Tumor of anterior pituitary, excessive ACTase production. Cushing disease, in that condition there will be hypertrophy of the adrenal cortex. Lung cancer or other non-endocrine cancer like cancer of the pancreas, neural tumors, okay, or adrenocortical tumor or hyperplasia. This is a tumor, adrenocortical tumor here. This is hyperplasia, okay. That may also lead to Cushing syndrome. But if it is the ACTase excess that stimulate the adrenal cortex, that will be Cushing disease. Okay, iatrogenic Cushing syndrome, person taking steroid, okay, that will lead to Cushing syndrome. In that condition, adrenal cortex will be atrophied. Okay, lung cancer or other neuroendocrine cancer, cancer of the pancreas or neural tissue, will lead to excessive production of ACTase from ectopic site that will stimulate the adrenal cortex. Adrenal cortex will be stimulated. It will be bilaterally, it will be increased in size. Okay. Tumor in the anterior pituitary also releases ACTH that will also cause hyperplasia of the adrenal cortex. Okay, we got that. So pituitary Cushing syndrome, adrenal Cushing syndrome, two type, hypertrophy or tumor, iatrogenic by taking steroid, other lung cancer, ectopic site of ACTH that may also lead to hypertrophy of the adrenal cortex. So tumor here, adrenal cortex, tumor in the pituitary gland, tumor in the lung, maybe in the pancreas, maybe in the neural tissue, may cause Cushing syndrome. If there is excessive ACTase production like this, then we call it Cushing disease. Okay. A patient with Cushing syndrome, characteristic feature includes central obesity. Central part is obese, the thorax and the abdomen. Limbs are more or less wasted or going to be wasted. Abdominal stira, this abdominal stira due to lack of formation of collagen. Okay, we got that. Moon faces, abdominal stira. These are the features of Cushing syndrome. It is more common in the female. What is the differential diagnosis of Cushing syndrome? Obesity associated with diabetes mellitus, adrenogenital syndrome, alcoholic pseudo Cushing syndrome. What is the diagnostic workup of Cushing syndrome? Overnight dexamethasone suppression test. Serial measurement of 24-hour free cortisol, a single midnight serum cortisol level. This is the diagnostic lab workup. What are the imaging studies to diagnose Cushing syndrome? CT scan or MRI of adrenal glands, MRI of pituitary gland with gadolinium, additional imaging studies to localize tumors of the lung, pancreas, kidney, and the neural tissue with ectopic ACTase production. Okay. What are the treatment options for Cushing syndrome depending on the situation? If there is pituitary adenoma, then transsphenoidal microadenomectomy. The better to be done with stereotactic radiotherapy for the children that respond very nice by radiotherapy. It works very good in children, but this is for the adult. Transsphenoidal microadenomectomy. If this does not work, then we'll go through total bilateral adrenalectomy. Adrenal neoplasm, surgical resection of affected adrenal gland, glucocorticoid replacement therapy. Okay, that is the idea. After we take out the adrenal gland, we must support by glucocorticoid. Bilateral adrenal hyperplasia, we do bilateral adrenalectomy. Okay, so we'll take out the adrenal gland, but certainly it will be supported by glucocorticoid. Ectopic ACTase, surgical removal of ACTase secreting tumor, control of cortisol by ketoconazole or metaropone, control of mineralocorticoid by spironolactone, bilateral adrenalectomy. So this is the treatment option for pituitary adenoma, adrenal neoplasm, ectopic ACTase. We have both surgical and also medical management. And that's all about the Cushing syndrome, Cushing disease, its physiology and pathology treatment. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.